Welcome everyone to today's webinar, Entering MIPPA-Qualifying Beneficiary Contacts and STARS. And welcome to those of you from the SHIP and MIPPA networks. We do have captioning today, so if you need closed captioning or if you'd like a transcript, you can look at the chat and there is a link to activate the captioning and the transcript. So our agenda today is to provide an overview of MIPPA qualifying beneficiary contacts. We'll talk about the performance measures impacted by the beneficiary contacts and STARS. We'll talk about the MIPPA qualifying topics discussed, a data entry checklist, and then most of today's webinar will be a live demonstration. At the end, we'll talk about resources, and there will be a little time for chatted questions. I should mention that if you're just joining now, you missed the file transfer, but we have about 5 handouts today, and they will be made available for download at the end. And they are also already in the SHIP resource library under recent, and also in the STARS resources kit under featured. And my name is Ginny Paulson. I'm the director of the SHIP National Technical Assistance Center. So first, we just want to start with an overview of the MIPPA performance measures. And the ones that are calculated from the beneficiary contact form are outlined in red on this slide. So there are 4 MIPPA performance measures and 3 come from the beneficiary contact form. The MIPPA qualifying topics discussed are very important to getting credit for your MIPPA efforts. And so here on this slide, you see all of the MIPPA qualifying topics discussed, and they're organized by category. So as you know, the topics discussed is comprised of several categories, and 3 of those categories are MIPPA qualifying, and the subset of topics within those 3 categories are shown here. So for example, if you look to the right, you see additional topic details. That's the last category of topics discussed on the beneficiary contact form and the beneficiary additional sessions form. Only one of the options in that subcategory is MIPPA qualifying, and that's preventive services. Also, if you look in the middle, I want to point out that currently the option to reflect that you helped with MSP application submission is written simply application submission. And that has been a frequently asked question. There is, if you look further down in the middle column, you see MSP application assistance, but there isn't the MSP application submission option. It's packaged with other Medicaid applications. So it does say that in the definitions associated with the beneficiary contact form, but I wanted to point it out on this slide to really make sure you're getting credit for those MSP applications that you're helping people submit. So also, we have a slide because this is just such an important issue, and it has resulted in a lot of data entry error. So again, you can see an excerpt here from the definitions. MSP application assistance is explained here, and it's in the Medicaid category. And then further down, you see application submission, and you don't see the term Medicare Savings Program, MSP, until you get to the definition, which of course it's the field that shows in STARS, not the definition. So that's been leading people to overlook that particular option. So that's where your handout is really going to come in handy. We have a new handout. It's 3 pages, and it's called At a Glance Reference, Beneficiary Contacts in the MIPPA Performance Measures Report. So here's your at-a-glance checklist, separate from the at-a-glance handout I mentioned, but this slide really tells you everything you need to do to get your contact into the performance measures report and have your program get full credit for your MIPPA efforts. So there's the MIPPA team member, which is reflected on the team member record in STARS. And I am going to demonstrate how you can look and see if MIPPA is selected on your own team member record. And then on the beneficiary contact form, BCF, and the beneficiary additional sessions form, BAS, MIPPA needs to be yes. And then the topics discussed need to be entered accurately. And then there are 4 different types of hard to reach contacts for performance measure 3, and they're listed here. And then performance measure 4 is all about application submission. And I will demonstrate all of those. So with that, I want to get right into the demonstration because it will take at least 30 minutes, and I want to give you some time to have your questions answered. So with that, I have already logged into STARS, and we are looking at STARS here. I have logged in as Edward Sims, who is a SHIP team member user of STARS. And I could try to zoom in a little bit here, make it easier for you to see. So Edward, as a team member user, has 3 menus, and we're on Home right now. Tracking inbox, and search. So the first thing I had promised to show you is how Edward could find out if he is a MIPPA team member. So he, as a team member user role, can only see his own team member form. Higher roles can see and possibly edit team member forms, but Edward can only see himself. And if you look all the way over to the right, you see that under Program, he does have MIPPA. So he can check that off his list. That criteria has been met. You can also open the team member form and scroll down, and you see that Program for Edward, he is a co-trained SMP team member who sends data to the SMP data system. He's a SHIP team member and a MIPPA team member. Of course, you wouldn't have had to open it, and it is read-only for Edward because you could see it right there on the tracking inbox. So now we're going to go into a beneficiary contact form and enter a MIPPA-qualifying beneficiary contact. So I want to point out that required fields in STARS are marked in red. I am in a test site. You can see up here it's a QA site. So this is for training purposes and testing purposes, and all of the data is fake data. In the testing site right now, required fields are marked with the red star. At some point down the road, the production site in STARS, the one that you use, will also mark required fields with a red star. Right now, when you log into STARS, you're going to see a red R. I just wanted to point that out if you were confused about why that's different. They test upgrades to STARS in this site before they roll them out to everybody in the production site. So you can see that there's no answer here. There has to be an answer for this beneficiary contact to save. And of course, we will say yes, we're entering a MIPPA contact. You can overlook, unless you're a co-trained SMP team member entering beneficiary contacts for SMP, you can overlook the send to SMP that defaults to no. And today I'm not going to dwell on SMP and SIRS. So right now you see there is no SHIP reference number. This number will autofill after you have saved. Next, it's very important to look at the session conducted by field. This is the team member who conducted the session. It defaults to Edward, and we know now that Edward does have MIPPA marked on his team member record. He could enter a beneficiary contact on behalf of somebody else, and these are the other people who he could enter data for, but we're going to leave it as Edward. He's entering his own contact today. The next field is partner organization affiliation, and that's not a data entry field. Like the SHIP reference number, it will fill in automatically upon saving, and it will be the partner organization affiliated with the person who conducted the session. The zip code of session location, we're going to say, in this test site, we're in the state of Virginia. We're going to say that the zip code is 23086. This is the field that will determine whether or not this effort is going to count as a rural outreach, or not outreach, but a session where you were helping a beneficiary in a rural area. And the system knows what's considered rural based on the zip code, but you can't see by looking at it. Now, there is the MIPPA performance measures report that's visible to directors and assistant directors does list all of the counties and whether or not they're in the rural area. And one of the new handouts explains that a little bit better. So in this case, the county of session location is King William, Virginia. And there is a drop down because if there was more than one county associated with that zip code, it would show. But in this case, there is not. All of those are required, as you can see, and you wouldn't be able to fully save if you left any of those blank. Now we have information about the beneficiary and the beneficiary's representative if applicable. They're not required fields, but ACL would like you to enter beneficiary first name, last name, and phone number to help them with some surveys that they're conducting, some satisfaction surveys they're conducting nationally. So we will say that this beneficiary's name is Doha G. Doha first name, G last name. And I'm just going to make up a phone number here, and I will say that this beneficiary doesn't have an email, we're not logging it in here, and there's not a representative involved with Doha. And now we get to geographic information about the beneficiary. Obviously, it defaults to the state of the logged in user, but if this person were counseling a beneficiary who resides in a different state, that could be changed here. I'm going to say that in this case, this is a local counseling session and it's happening in the same zip code that the beneficiary lives in, so they do match in this example. Now we come to the date of contact. I can't emphasize enough that it's very important to have an accurate date of contact. It's easy to make typos here. If you're going to manually type it in, and let's say you wanted to put in 2/21/20, you can see that's not a valid date. There's a requirement that it's 2 months, two digits for the month, 2 digits for the day, 4 digits for the year. So even if I were to get that right, it's still just really easy to make a mistake. And when mistakes are made in the date of contact, it's a little difficult for people conducting quality assurance to figure out what went wrong. Why isn't this contact showing up? I know it occurred. They're telling me it occurred. I can't find it. We have found many times over that it's because of data entry error in the date of contact. So I tend to lean on this date selector tool to choose my dates of contact. And you can see because I had already entered the wrong day, it's reflecting what I had incorrectly entered. When this is in a blank form, of course, it defaulted to today, and most of the time people are getting to their data entry in stars after the fact. So I want to reflect when that contact actually happened, and I'm going to say that it happened on February 6th. And I'm getting to the data entry now. One more tip about the date selector. you have about 30 days to get your data entered into STARS. So let's say that this contact happened in January. The easy way to get to January is to click on this single pointing arrow. Then you could pick your day in January where it occurred. However, again, to avoid error, make sure you didn't accidentally select the double pointed arrow because that takes you back a year. So I just want to point that out. Again, you want to get credit for your work. You want to make sure that managers know what happened in your area and your state in a given month. So the date is just so important. Again, let's say we'll go back to the day I said it occurred, February, but I did accidentally pick the wrong year. So let me go back to 2020, February 6th, 2020. Just going to take a good look at that, make sure I've got it right. How did beneficiary learn about SHIP? We'll say it was a relative who referred this beneficiary to us. The method of contact, we'll say it was at a counseling location, face-to-face. And this beneficiary's age group we're going to say is 65 to 74, female. And now we get to the beneficiary race. This is one of the data entry fields that affects the MIPPA performance measures. So I'm going to say that this beneficiary is Asian. This is not going to affect performance measure 3 in terms of the beneficiary race. Let's see here. Okay, but if I had selected this one, it would count. But I'm going to show you that one in an example soon. Okay, in this case, English as a primary language. That is another field that affects the performance measures, performance measure 3, as does age group. And I'm going to demonstrate that in the next one, but I just want to point out its age group is an important field to pay attention to, race, English as a primary language, and also this last one, receiving or applying for Social Security disability or Medicare disability. In this case, I'm going to say that English is not the primary language for DOHA. And that is what qualifies this beneficiary contact form for performance measure 3. Income, we will say it's below the federal poverty limit. Assets are below the limited income subsidy asset limits or extra help. And we'll say that no, she is not applying for Social Security disability or Medicare disability. Now we get to topics discussed. I'm going to bypass any of the categories that are not related to the MIPPA performance measures report. So I need to scroll all the way down to Part D, low income subsidy, LIS extra help. And I'm going to say that we provided application assistance. We provided application, we helped her actually submit an application. We provided a benefit explanation. We helped her with screening for her eligibility. And just to show you all of the categories in here, also the LINET program and best available evidence. Now, the next category that applies to MIPPA contacts is Medicaid. And in this case, we'll say that we helped with an MSP application submission. We explained that benefit. We helped her understand her eligibility for that benefit. And we provided application assistance for the MSP program. There are a few other topics in this category that apply to, that are MIPPA qualifying that I did not select in this case, and they would be Medicaid buy-in, or let's see, Medicare buy-in coordination. I'm looking at paper and my screen here. Recertification, and this one counts toward performance measure 4. And then Medicaid application assistance. Those would have also qualified, but I did not use those in this case. And then under additional topic details, I'm going to say that we talked about preventive benefits. That's the only MIPPA qualifying topic in this category. Now we get to time spent, and you see that we've got time spent in hours, time spent in minutes. Neither are required, but down here is a field that is required. It's calculated based on my entries in the above cells. So I'm going to say this was a rather lengthy session, and it was 1 hour and 15 minutes. So that's a total of 75 minutes, and this is how reports calculate time spent. And in this case, I'm going to say that the status is completed. To my knowledge, we met all of her needs in this counseling session. If we scheduled a second appointment and really couldn't finish up because we needed some more documents and that was going to happen in a follow-up appointment, we might put in progress. And in progress does not relate to data entry. It relates to the actual situation that this beneficiary is being counseled about. So completed is the right answer here. For this session, none of the special use fields apply, so I'm just going to skip past those. If I had some notes, I could enter notes here. It's optional. It might be at your within your program. Perhaps there are some things that they're asking you to enter in notes. Perhaps they have files they want you to attach, but these are not required. And so with that, I am going to just save this form. And it tells me it's saving. And now I'm back at the top. It doesn't tell me whether or not I successfully saved. It told me it was in the process of saving. There's not on-screen text that tells you, yes, you successfully saved this. But there are indicators that you've successfully saved your work. One of them being, we now have a SHIP reference number. You only get a SHIP reference number on successfully saved beneficiary contact forms. We also can see that the partner organization affiliation has auto-filled. That only happens after it's been saved. We also have this beneficiary additional sessions tab, and that is only visible when there is a successfully saved beneficiary contact form. So you can rest assured that this contact was saved. So now I'm going to go back to the tracking inbox, because now what I want to do is show you how you can update or how you can enter a beneficiary additional session. So in my situation, I have a beneficiary named Carol Cook, and I've had a second session with Carol Cook. So I'm going to use the search menu to find her. I'm going to use a standard search, and I know that I have a beneficiary contact form entered for her, so I'm selecting that one. And her first name, Carol. Her last name, Cook. I could enter other criteria, but that will suffice for finding Carol. So here is the beneficiary contact form for Carol. There was a session on February 5th. So when I click on that, I can see the data from our original session that occurred. So now I'm going to add a follow-up session. I click on Beneficiary Additional Sessions. This is our first follow-up session related to her original contact. So I'm going to click New, and now I have a new form. It's not identical to the beneficiary contact form. It is more streamlined. It has all of the topics discussed, but it doesn't have, doesn't ask me to enter all of her demographic information. But I do need to say whether or not it's MIPPA related, and the answer is yes. Who conducted the session? It was Edward again. And then the zip code of the session. I don't have that written down. Let me go over here. I'm going to look at her beneficiary contact to get her zip code. I know I have it. It's the same place as before. So it's 23930. I'm probably going to have to start fresh, but at least it was right handy. Okay. Yes, this is MIPPA. Edward. 23930. And that's Nottoway, Virginia. By the way, this county is considered rural. I happen to know that, but again, this is going to qualify this contact for performance measure 3 based on actually based on the beneficiary's zip code, but this was a counseling session that occurred in her county near her, and so that counts for performance measure 3, rural. And then the date of contact, we're going to say it was just yesterday. And again, it was face-to-face at a counseling site. Again, we're going to go to the topics discussed. And what we did in this counseling session is we submitted her applications. In the original session, we just talked about, you know, what she might be eligible for, explain the benefits. But here we actually assisted with an application and helped this person submit an application for LIS. And then we're going to also have done that for MSP. And how much time did it take? I'm going to say we spent an hour. And the special use fields, original and new, don't apply to this situation, and we're not going to use any of the special use fields for this situation. Again, there may be, there are times when field 3 gets used for specific purposes, such as during open enrollment and so on. And your local program may have designated some of these fields for you. And also I should point out that in the version of STARS you're using, there aren't as many. In the future for you, there will be this many, but again, this is the test site, so that's why there's that slight difference. Don't have any notes or files, and then I'm going to click Save. And it's telling me it's saving, and now I know it's saved because I'm here and I can see that it was logged, just like a tracking inbox appearance. What I want to do, though, is go back to the original beneficiary contact for the original session with Carol Cook and point out some of the ways in which the original beneficiary contact form affects the MIPPA performance measures report. So we had that counseling session with her, and we can see some of her demographics. In her case, she is 64 or younger, and she is receiving or applying for Social Security disability. That is one of the MIPPA qualifying demographics for performance measure 3. Also, she is American Indian. That is another qualifying demographic for performance measure 3. So I just wanted to make sure that you knew that. We talked about that a little bit before. Then finally, I want to go down to the bottom of the beneficiary contact form, and we had marked this as in progress because when we first talked to Carol, we knew she was going to be coming back and we were going to submit that application. So now that that's happened, this is completed. It's not in progress anymore. So I'm going to mark save. And finally, I just want to show you what error messages look like if you neglect to enter some of the required fields. We'll say I'm going to click new. I could enter another additional session if I wanted. I don't want to, but I just want you to see the kinds of errors. So I'm going to scroll to the bottom and I'm just going to click save, knowing I haven't completed the required fields. And you get validation errors, and it tells you what you have to complete before this can be saved. And these are hyperlinks down to those areas of the form. I've been asked, is there an error message if I say MIPPA yes, but then I don't select a MIPPA qualifying topic? And the answer is no. There are currently no on-screen messages that tell you you selected MIPPA yes, but you don't have the other criteria required. And so with that, I'm going to stop sharing my screen. And I'm going to go through a few more slides about STARS resources. So this is an overview of handouts available in conjunction with today's webinar. They've been uploaded into the resource library with today's webinar, and they'll be available for download at the end. The newest one that I think you'll find helpful is this MIPPA and STARS at-a-glance reference. I think I might actually share my screen and show that to you here. I have it open. It's color-coded and it by performance measures, and it's just about the beneficiary contacts. So again, 3 of the 4 MIPPA performance measures. So for performance measure 1, you look at the blue. For performance measure 3, which is more complex, you look at the yellow. And for performance measure 4, you look at the green. And then page 2 talks about what's the rural definition. And again, it's all based on zip code. So it explains that. And then it's got the topics at a glance with the definitions excerpted from the STARS manual. And it is chapter 4 of the STARS manual that explains how to enter beneficiary contacts. So you have the ones associated with LIS, the ones associated with Medicaid, and additional topic details. And for those of you who are attending who might be directors or assistant directors in STARS, here is one of the tabs on the MIPPA Performance Measures report. It's about the Performance Measure 3 rural beneficiaries. And this is just a sample from the state of Virginia. It's from the test site, so there's not, very much data, but it says county designation. You see the county name and then the county designation. Out and MIC are the 2 codes that mean it's considered rural by STARS. And so if we go back to this at-a-glance reference and we go back to Appendix A, the rural definition, it tells you of the 6 designations, large central metro, large fringe metro, and so on, it's the micropolitan population of 10,000 to 49,000, or out, where it's, lower population. Those are the 2 that count toward rural. And there is a handout on rural. It's really just an excerpt from today's PowerPoint. And that data entry checklist is also just a print of the slide about that from today's PowerPoint. You have the STARS manual, 5 chapters which focus on data entry. The introduction talks about the different programs that use STARS. Obviously, Chapter 4 is the longest chapter, and that's the chapter that applies to today's topic. And then there are job aids and handouts and PowerPoints about other aspects of STARS, such as searching, using the reports, understanding user roles at a glance, and so on. You've probably all been to STARS, but this is the address for it and the landing page, and there is a link about our resources here at the SHIP National Technical Assistance Center, or SHIP TA Center for short, and then there's a link to the Booz Allen STARS Help Desk. If you get locked out, if you forget your password and don't get the email about it and so on, you would want to contact the Booz Allen STARS Help Desk. Our website has this SHIP login, this orange padlock, and that's how you would get to our password protected area to see the STARS resources. And here are your contacts for individualized technical assistance. And I think this is the point where our producer is going to help us with the questions. So it looks like we have about 20 minutes for your questions. And he's going to make the files available for transfer as well. So I'm going to take a look at the chat and see what we have. What do we put for race if none of them fit? So you just have to do your best to make a choice for race. We know that's not optimal, but that's really the best that we can do. I'm going to take a look here at your options and I'll just read them. For race, you have American Indian or Alaskan Native, Asian, Black or African American, Hispanic or Latino, Native Hawaiian or other Pacific Islander. That also is MIPPA qualifying for performance measure 3 regarding race. White or not collected. So you just, there's not a way to select anything else. If your state would like to use a special use field for additional races, that might be an option. If you choose to type it in notes, it's very difficult to find later. So if you're using a special use field to document race, you want to get on the same page with the rest of the people in your state about which it is that you're going to use. And then you can use the search in STARS to find the data entered for that special use field and see how many of these other races you might have entered there. Okay. And then there's a question, will you cover how to create a MIPPA report drawdown? That wasn't part of the scope for today's webinar because we're talking about entering beneficiary contacts. We did do a webinar in September 2019 about the MIPPA performance measures report, and so you would want to refer to that. If we have time, I can definitely log in as a higher level user and go over that. And I see, you know, we scheduled this for an hour and we have 20 minutes left and we're not being overwhelmed by questions. So I will definitely do that if I get through all the questions. Okay. Somebody said, I thought we put the zip code of the AAA helping in that first zip code box. Are you saying that we always put the beneficiary zip code there? I thought you put it in the second zip code. Yes, you put the zip code of the session location in the session location zip code area, and you put the beneficiary zip code in the area for the beneficiary zip code. It's it just, in my example, it happened to be the same zip code. Okay. Where can I get a copy of the manual? I'm new to my position. That is at, let me go back up a slide. Actually, I think the producer had, thank you very much, David. There's a slide on, if you want to go back one more, maybe it's 16, yes, okay. Well, maybe go back to 15 for a second. So if you are at the STARS landing page and you see that link under Need Help with STARS, if you click that, you'll get to what you see on slide 16. So producer, if you could go to slide 16, please. On the next slide, if you would click the STARS, yeah, there we are. You see there's a red box around ship login. When you click there, you log into our website and then you go to the resource library and there's a STARS resources kit featured there, and that's where everything is, including the manual. Although the manual by itself is also featured in the resource library. It's a second item. If you don't have an account on our website, you can apply for one by clicking ship login. There's a button to register. So that would be the other option, or talk to your supervisor and see if somebody in your program can make an account for you on our website. Then someone says, can we check off MIPPA? Yes, if the only things addressed are benefit explanation for LIS programs and the person is above 150% of the federal poverty level. I am going to actually punt that question to Maggie, but I do know that if you type benefit explanation for LIS and MIPPA is yes, and the team member who conducted the counseling session has MIPPA on their program, that effort is going to go to the MIPPA performance measures report. So as far as if you're supposed to check benefit explanation for LIS if the person is above 150% of poverty, I have to turn it over to Maggie for that.
Hi, Jenny, can you hear me?
Yes, we can.
Oh, good. I had myself double muted. So for that situation, you would check yes, right? Because the whole idea of MIPPA is that we're educating beneficiaries on the information. So that first step in that conversation is seeing if they're eligible and talking about it, right? So you would check that. It would count towards the contacts, but then of course, since they will ultimately end up ineligible, and so you would not complete an application, it's not going to count in that application submission section.
Thank you, Maggie. I think this next question might also be for you, Maggie, but I'm going to read the question. It says, for credit for application submission, do you actually have to submit the application or just explain how and when to submit the application? When I read the definition, if it's under Medicaid, so for MSP application submission, check this box to indicate submitting a Medicaid and/or Medicare Savings Program application. So that's literally what the definition says. And then for LIS application submission, check this box to indicate submitting a Part D LIS extra help application, either paper or electronically via the Social Security Administration's website. And Maggie,
right, that is correct. And just to add, you know, what the questioner is describing, that whole idea of walking someone through the process and kind of helping them think about it could count as application assistance. But for PM4, we're really looking at, did you complete an application on their behalf and help them submit it?
Thank you, Maggie. Somebody who has a director account in STARS had said they're seeing county designations such as SM and MM as well as OUT and MIC. There are multiple tabs on the MIPPA Performance Measures Report for directors and assistant directors. And if you click through the tabs, you'll notice on many tabs you have all of the county designations, but at least in the test site for performance measure number 3, rural, they cone that down to just the counties with rural designations. So in the screenshot that I showed, I was literally on the tab for PM3 rural, and there are other tabs for performance measure 3, like for race, for zip code, or excuse me, race, English, and age group. So, well, the age group and the applying for Social Security disability, they have a different tab for each of those. So I think that's the issue. So take a look at that specific tab for rural and see if you're just seeing OUT and MIC there. Okay. Then we have, do I check MIPPA for doing a qualifying discussion whether or not the client is qualified? I think that goes back to what Maggie was saying. If you're educating them about MIPPA, even if they're not currently qualified, you know, that's still part of the program. And then someone said, I am a local SHIP coordinator. None of my counselors have search access in the STARS system. How do I correct that? They must have the STARS submitter user role. The STARS submitter user role does not have the search. However, they do have a tracking inbox, and they are able to see all of their own entries in the tracking inbox. So they might not need the search, but if you want them to have the search, they would need to be a team member user role instead. That's one level up from STARS submitter. They're very much the same, but the team member user role does have the search menu. Could you explain again how to enter a second contact for a person you've helped in the past? The person got called away during that portion of the event. Yes, I will do that. There's only a couple other questions, so I think I'll do that in just a second. Is MIPPA equal, this is a new question, is MIPPA equals yes required for every interaction? No, MIPPA yes should only be marked if all of the different criteria apply, especially the topics discussed. That would be a good rule of thumb. At a minimum, there has to be a qualifying topic discussed, and if there is a MIPPA qualifying topic discussed, it will always count for performance measure 1 as long as you have marked MIPPA yes and the team member who did the session has MIPPA on their team member form. So you wouldn't select yes for every single interaction, no. Okay. Then let's see. I live in a county with 34,000 people, so am I to assume that all my contacts are rural and are MIPPA qualifying? The 34,000 people, according to the definition, would be, I'm going to look at that here, would be micropolitan, MIC. And so if the beneficiary residence is in a county that's micropolitan, and there was a MIPPA qualifying topic discussed, and you mark MIPPA equals yes, then it's going to go to performance measure 3 on the MIPPA performance measures report. Okay, if you complete an LIS application and leave the box for sending to state for MSP, does that count for an MSP application? I believe this must be referring to the LIS application itself, not STARS, and so I'm sorry I can't answer that question, but Maggie, do you have an answer for that question?
I am not certain. Let me check on it and get back. I know we've discussed this before and I can't remember where we landed. But
Okay.
Can I share the answer with you, Jenny, and you can send it out somehow?
Yeah.
Or we can add it to
Sure.
documentation? Okay.
So here's another one, Maggie. If you walked the person through filling out the application over the phone and the person mailed it out themselves, would that be considered application submission?
here. I'm thinking about that question.
Sure.
I mean, I know a lot of folks do it that way. So I'm going to say yes. If you really spent the time to help them complete it and you need them to then submit it on their own, given the way that you're interacting with the client, then that makes sense. If you're just kind of providing them a little bit of information and then sending them off to finish completing it on their own, then that would not count.
Okay. All right. Someone said, I don't have access to the resource library and the SHIP TA Center website even after I log in. Why is that? That's because when you were certified to be a counselor, no one increased your role to counselor. The trainee role on our website only gets you to the training and certification tool. And so you don't have anything else. So you will need to ask your supervisor to have your role increased to counselor. The next question, we get calls from beneficiaries that already have MSP and are calling with other Medicare questions. How do we record this contact? Essentially, the SHIP program helps with all of the different topics on the beneficiary contact form. There are the MIPPA-Qualifying topics, and I don't know if this person is just a MIPPA team member and not a SHIP team member. So that's where I don't want to give the wrong answer. But from a literal STARS perspective, if you complete a beneficiary contact form, exactly how that session transpired, if you mark MIPPA yes, but it's not MIPPA qualifying, in other ways, it's not going to go to the MIPPA performance measures report. But even if you mark MIPPA no, that's fine. Not everything is MIPPA. It's just, I can't speak to if you're only wearing a MIPPA hat and don't conduct SHIP work. You'd have to talk to your supervisor about what to do in that case. Okay. Someone said, in order to show application assistance, I thought we had to have documentation of the submission. Know that the definition of application assistance stops short of having to help them with submitting. So I would say assistance and submission are apples and oranges. They have separate definitions on that handout, which is available for download. Do you have anything to add to that, Maggie?
Well, I just noticed that commenter jumped in a little bit later and said, correction, in order to show application submission, I thought we had to have documentation of the submission. So they caught themselves on that issue. And she then said, i.e. copy of application or fax receipt. My understanding, you do not have to have that from all of the documentation that I have seen. I know that for Medicare Part D outcomes and tracking that for the SHIP work, there's a lot more you need to be stating. And so there could be some confusion between those two.
Could be.
Yeah.
Somebody said they educate all their clients on MIPPA. And so select MIPPA yes, and this corresponds to benefits explanation. That sounds reasonable to me. Maggie, do you have any other thoughts on that?
I'm not sure which comment you are responding to. Are you talking about the one where they select yes on every form?
No, it's the proactive education on MIPPA for all
I
clients.
See. Yeah, I mean, I think that makes sense. However, going back to the example someone provided before of, doing outreach and education in a retirement community that everyone in the complex has upwards of $100,000, so they're not eligible for MIPPA, then it doesn't make sense in that scenario. But if you're going into a community that's mixed income or is disproportionately low income, then it could make sense.
Okay, thank you. And David, our WebEx producer, could you pass me the ball? I'm going to share my screen to show again how to add a beneficiary additional session. Because I will need to see my own, well, I can leave the file transfer up there and just scoot it to the side. All right, I wanted to mention, I want to also look at this handout, this new handout. If you look at Performance Measure 3, it's the zip code of beneficiary residence that affects Performance Measure 3. So just to be a little more clear on that. All right, then I need to find stars. Hopefully I didn't get logged out. Okay, I'm back at stars. I'm just going to go back to home. So even if I'm a stars submitter, I have, the tracking inbox. And that is where you can see your own team member form, see all of your media outreach and education entries, group outreach and education entries, beneficiary contacts, just so you know. You could sort by first name or last name. So for example, I could have found Carol Cook this way. I wouldn't have had to go to the search menu. I'm going to open up Carol, and to add this would be for a related beneficiary session. If you help Carol in February and then, October rolls around and she comes in for counseling for an open enrollment period and it's not related to the help provided for the MIPPA program in February, you would just you wouldn't add a beneficiary additional session. You would start a new beneficiary contact for her. Okay, so I'm going to click this tab, and in this case, there was one here already, but if I were going to add another one, it's always this plus new button that you select. You click plus new, and it gets you a blank form. And again, it's abbreviated because the demographics are on the main beneficiary contact form for that beneficiary. So you really just complete the information about where this particular session occurred, the date, what you talked about, how much time you spent, and then save it. And that's what happened when this one got added. So the other thing is somebody said they can't get to the SHIP manual. Essentially, I've already logged in, so I should log out. This is what the login page looks like. If I don't have an account, you can click the green button and register for an account. And then it has to be approved. So it will be approved by somebody in your state who has that level account on our website, which is not to be confused with STARS, which is a different website. So for example, if I go in as a counselor, whoops. Again, this is an account I set up for demonstration purposes. Everyone will have their own account and their own password. Then you want to go to the resource library. And here you have, for example, under recently added, today's webinar. Here's the STARS resources kit. Here's the STARS manual. So in the STARS resources kit, we collect everything about STARS. There are things that aren't in the manual right now. We have our basic training for completing a beneficiary contact form. We have today's webinar linked here, but here's the manual. And so you would download the 5 chapters. We haven't compiled it all together because we want to do that after the reports chapters are written. And then the last question that I wanted to address, I know we're 1 minute after, so for those of you who are willing to stay just a couple more minutes, for the sake of the person who asked about downloading the report, I am going to log in as a director level user. And this again is our test site.
And Jenny, while you're pulling the report to show them where to download it, I did want to just jump in. I realized Melinda's question about application submission and whether or not you need to save documentation. The guidance I provided was for our state grantees. If you're a sub-grantee, your state director may be requiring that for your MIPPA funding. So that guidance may be a little bit different if it's coming down from the state. So I just wanted to clarify what my answer was.
Okay, thanks, Maggie. So I'm just going to keep this quick because we do need to end for today. If you're a director or assistant director, well, anybody who can get to the MIPPA performance measures report, manager level users as well, go here, shared pages, MIPPA performance measures report. I'm going to pick the state level here. I'll just pick a month. Launch the report. So there's the summary page. That's here. Assistant directors and directors have these tabs. So PM 3.2, I believe, is the one that's related. Nope. It's rural is 3.3 here. So that's where you see the county designation, and this, it's just keeping only the out and the mic on here, but others that aren't based on rural, then it's including other kinds of counties. So that was the question. People were seeing other types of counties, but it might have been because it was a different tab. You can see there's a tab that cones down the data for the kind of beneficiary that applies to performance measure 3. But users who aren't a director, assistant director, or state staff user currently just have the summary for their, if there's a sub-state or a site, they're only going to have the summary. And with that, we do need to end for today. So thank you everybody for attending.